More on the forecast in a moment, but first at 6, it's top of mind this month for many families enrolling in next year's healthcare plans.
Yeah, many are comparing the cost, which plan is best, which would save money. But imagine opening up your plan and seeing a 500% increase.
And all of a sudden now, you're just going to break it off on the backs of the employees or the retirees.
You can't just change your whole retirement life in a month or two.
Earlier this week, a viewer sent us an email about a skyrocketing change in city health benefits for retirees who worked for the city of Olathe. We then listened to concerns from retirees.
Our Johnson County reporter Elise Schoenig has been following up with retired employees about these changes and how they're impacting their retirement benefits. Elise?
Well, retired Olathe Deputy Fire Chief Todd Hart has a plaque on his wall displaying his service of 31 years. He says that he's taken that plaque off his wall and moved it to his basement because he says this represents how he feels as he prepares for a 500% increase in his health care costs from the city. Can you tell me what we're looking at here?
This was the city's stance in 1989 until 2005.
Todd Hart captured his memories on the job.
In this 21 years, nothing has changed.
In his 3-decade career, he saw a lot, and he's seen these words before.
Here's one example that we provided.
Todd showed me documents from when he helped lead a city task force in 2005. The group came up with alternatives to changing health insurance premiums then. He says nothing came of those ideas.
And all of a sudden now, you're just going to break it off on the backs of the employees or the retirees.
With the premium increases, he says his wife will have to move to the Affordable Care Act marketplace, and he'll move to a city plan that was once $80 a month that'll now cost close to $500 a month.
This is really the first time in a number of years that outside economic factors have really influenced as sharp of an increase as this.
City of Olathe spokesperson Cody Kennedy told me Tuesday the city is not immune to costs that are rising everywhere.
We understand that retirees have limited income. We also understand that employees have certain things they've got to pay for with children and all of those costs as well.
Kennedy says the city's insurance is lower than what the state statute sets, and that it's why its employees are able to retire early.
I feel like I'm just a number.
Todd Hart's memories are framed.
What are you telling the people that are working there today?
But now they display a different picture.
This is absolutely ridiculous. This is not sustainable.
And it's unclear if he'll ever see change.
Holding out hope that the city does the right thing.
Okay, so Todd told me that he hopes and really needs city staff to lower these premium costs so that these retirees can all afford their health care. Now, I did get another email from a retiree today showing me that the city did extend its window to enroll to December 3rd. Now, that same city spokesperson also pointed me to some free resources to help retirees and employees as they're mitigating those increased premium costs. This includes a well-being center for physical and wellness visits and a bundle service for routine surgeries and care. And I did check in with other cities too. A Lenexa spokesperson told me their retirees do get coverage when they retire and that their costs from this year to next only increased slightly. In Overland Park, they told me that their retirees get health and dental insurance based on their years of service. I have reached back out to both of these cities to get additional clarity on those costs and any increases. But if you've seen an increase in those cities or any city, scan the QR code and send me an email. I'll keep working to get some more details. In the studio, Elise Schoenig, KSHB 41 News.